71% of patients with critical limb ischemia who got amputations unfortunately never received any vascular intervention before that. I'm Georgi from Kelvin Health, and our mission is to make preventable deaths and suffering from vascular conditions a thing of the past. To achieve that, we built a team with extensive AI, medical science, regulatory, and business development background. Actually, Kelvin Health started as a result of multiple serendipities with the health of ourselves and our loved ones. Going back to the summer of 2018, my wife and I were devastated when her father, Hugh, nearly lost both of his legs because of late diagnosed peripheral arterial disease as a result of his diabetes. And unfortunately, he is just one of more than 230 million people worldwide who have PAD. And because of the hard access to precise, accessible diagnostics, more than 22 million people, which is above the average population of a whole European country or the state of Florida, develop critical limb ischemia, a condition with very bad prognosis that first takes your limb, then still remains very likely to kill you in the next 5 years. The problem lies in the lack of enough vascular specialists like Professor Petrov, the lack of non-invasive precise diagnostics, and the lack of efficient screening programs. So we decided to put our expertise in image AI and build a solution that is as easy as using a thermal camera like this one to capture the heat of the legs of the patient, segment the different arterial zones, and understand where their PAD and to what severity level. This whole concept is possible because our local body temperature is directly related to blood flow, and we can detect the pattern and train machine learning models to assist in the diagnostic process, ultimately aiming to make it more efficient, both in terms of screening and triage, and lead to cost, time, and patient limb and life savings. We concluded experiments with more than 2,600 patients in Europe, comparing to the digital standard, to the digital subtraction angiography, which is the gold standard of diagnostics, and see very promising results. We extended this research to multiple clinical sites in Europe and are currently seeing strong interest from US healthcare professionals and key opinion leaders about the impact that we can bring in both early screening in primary care and also rapid triage at the specialist. If Kelvin Health is applied during every visit at the specialist in US and Europe combined, we get more than $800 million of serviceable addressable market. Our next steps include the de novo clearance by early 2027, and then going towards reimbursement in the context of Medicare, and partnering with insurers and healthcare providers and hospital systems to provide access to a wider scope of population. We're currently self- and grant-funded, but open for funding opportunities to speed up the development process, a total of $7 million in the next 3 years. So, in conclusion, if our solution was on the market 7 years ago, the legs of my father-in-law, Hugh, wouldn't have been at serious risk because he could have been diagnosed during a regular visit in just 2 minutes at his family doctor. Thank you, and I'm happy to discuss further opportunities afterwards.